there. My name is Dr. Cozy. It's really nice to meet you. And I saw in your paperwork that we have you here today because you've been experiencing some floaters in your vision, correct? Okay. Let me just pull up my program here. Okay. So if you were to describe them, would you describe them as like clear blobs, streaking flashes of light, a dark shadow, or maybe like a black curtain over an eye? Okay. Are you seeing them in both eyes or just one? And are you able to clear them at all? Do they move, change shape? Okay. Any recent injury or trauma to your eyes or your head? How about any recent visual changes such as blurry vision, increased near or farsightedness? Do you experience ocular migraines? Okay. Any history of cataract surgery? And are you diabetic? Okay. All right. So in just a moment, I'm actually going to be turning off the lights. Before I do that, I would like to check your vision. So, behind me, you'll see I have a vision chart here. Can you read for me whichever line is comfortable for you? Okay. Are you able to recognize any of the letters on this line? How about this one? Okay. Can you tell me what color this is? And how about that one? And are you able to recognize this number? How about that one? Okay, great. Alright. So now what I'm going to do is, actually before we turn the lights off, I'm going to do a quick test. So this kind of resembles one of those old Viewmasters from the 80s. I'm going to hold it up over your eye. Just like so. Okay? You able to see the image? Can you identify it for me? Great. Okay, sorry. How about that one? And is it sharp or blurry? Okay, sharp or blurry? Sharp or blurry? Okay. Tell me when this becomes more in focus. Good. And tell me when this becomes more in focus. Good. Again. Good. Last one. Great. Now I would like you to focus right here, right in between my eyebrows. And while you're focusing there, I'm going to be holding up a different amount of fingers in your peripheral. I'd like you to tell me how many fingers you see me holding up, okay? Okay. So, good. Excellent. All right. So now I'm going to be turning off the lights, okay? So. Part of my reach here. Any difficulty with adjusting? Okay. So, focus straight ahead. Keep your gaze on my forehead, right between my eyebrows. Good. All right. Tell me when you see my light enter your field of vision. Good. Again. Okay. Now I would like you to follow my finger just using your eyes, and I have my light illuminating it so you'll be able to see it. It's kind of like E.T. So without turning your head at all, I'd just like you to follow my finger just with your eyes. So. Good. Alright, now I'm going to be looking at the vessels inside of your eye. So continue to gaze directly ahead. a little longer here. You're doing great. Okay. And then again, I'm going to look from this side. Alright. I didn't see anything remarkable involving the vessels of your eye, which is a good thing. It may not sound like a compliment, but it's good. So now I have this spheric lens I'm going to be using to look very close up at your eye, okay? Both eyes. It's going to help me look at the surface at the cornea and see if there are any injuries. If I'm not able to get a good picture, then we will use our slit lamp here, in which case I will be needing to dilate you, and I will also be applying a contrast. It's a yellow contrast, and it should last for only about 30 minutes. It may make your tears yellow for a while, and it may make your sclera, the whites of your eye, also have a yellowish tinge, but it should be gone by the time you leave here, okay? Okay. So, I'm gonna have you just look directly ahead from me, okay? And I'm going to shine my light and straight like so. Is this okay? Okay. Alright. Can I have you look up for me? Good. And straight ahead again. Keep gazing straight ahead. And look up again. Okay. And straight ahead. See where my finger is over here? I want you to look in that direction for me. And then my finger here. Yeah, perfect. Look up. Look back over here. Right over here. Okay. I'm not able to see anything clearly, so I'm going to go forward and use our slit lamp here to get a better picture. First wheel, I'm going to apply those drops. These should not sting or be uncomfortable at all, okay? Promise. So, I'm going to tip your head back just slightly. Just like that. Alright. There's one. Blink a few times. And tap away some of the excess here. So it's going to take just a moment for that to actually do its job in terms of dilating. So if you don't mind waiting for just a moment, I'm just going to type a couple of notes up while we wait. I'm not going to shine my light directly into your eyes. I just want to check how dilated you're looking. Okay. Looks like we're there. So I'm going to move my slit lamp into position here, alright? So bear with me for just a moment. Okay, so if you want to line your forehead up right here on this bar. Good. And then set your chin right there on the chin rest. Is this a good height for you? Is it straining your neck at all? Alright, because I can adjust it if needed. Okay. It's a little bit of a bright light. I'm sorry. But you should see a screw located right about here. If I can have you gaze directly at that. Perfect. Okay. Can I have you look up for me? Good. Okay. Now, see my finger over here? Yep. Look at that. And then this finger, please. Okay. And now look up. And directly ahead again, please. Okay. So keep looking directly ahead. And let's have you look up. I'm gonna add an additional light. So place that right there for a moment. Keep looking up. And then gaze directly ahead again for me. Okay. Keep gazing directly ahead. Trying to get a good position here, sorry. Alright. Actually, there we go. screw. Alright, sorry about that. Look over my finger again. I'm gonna move this guy out of the way here. So, keep looking directly ahead at that screw. And look up. And look at my finger. And the other finger. Alright. Straight ahead. Alright. And look up. Look at my finger. Okay, and my other finger. Look up one more time. Look at my finger. Okay. And look at this one now. Straight ahead, that screw. Okay. You can move your head back, and I'll get this out of the way here. Okay. So I'm going to go ahead and turn the lights back on here. Go slowly so that way it doesn't strain your eyes. Okay. So, how is that? Is that okay? Okay. Not too bright. Okay, good. So, again, I didn't see anything with the slit lamp. So I most likely would like to refer you to an ophthalmologist. Before I make that decision, I'm I'm going to do one more examination here. And this will be a physical exam. I'm going to be palpating around your eyes, just looking for any kind of inflammation, any bony changes, or anything that might give a suggestion as to a cause for the floaters that you're seeing. So, is it okay with you if I touch your face? Thank you. Okay. Can I have you close your eyes for me for just a moment? Thank you. Okay, you can open. I'm not seeing anything. So, most often when it comes to floaters, the cause is an age-related change to the vitreous humor. And often we can form some like cords that cast shadows that get interpreted as those floaters that we see. Every now and then it can be caused by something else, for example, an injury to the cornea. So what I'd like to do is refer you to an ophthalmologist to have them do an assessment and see if any treatment is needed in this case, okay? Okay. So let me pull up here. So it looks like you have pretty good insurance. Let me see if our ophthalmologist that we generally refer to as a network. Okay, so it looks like she is. So let me send her a little note here. So that note is on its way. And our front desk actually will be able to schedule for her if you would like to schedule that appointment today. I do encourage you to do it as soon as possible, partly because her schedule fills up, partly because if it is in fact an injury that I'm not able to identify on my exam, we want you to get this treated as soon as possible so that it doesn't exacerbate, okay? Okay. I'm sorry I can't bring you more answers, but I can direct you in a direction where you should hopefully be able to get them. Do you have any questions for me? Okay. Well, if you happen to think of anything, please feel free to give me a call, okay? And otherwise, I will see you for your next eye checkup. Okay. So, make sure you stop at the scheduling desk on your way out.